सर प्लीज हमारे सभी विशिष्ट अतिथि आगे आ जाएं। So a smile on the face. Time for a picture. Thank you. Now I invite Dr. Samir Matuji to receive the memento for Professor Meenu Mahajan ji, Principal Government PG College. और अब हमारे अति प्रिय समुदाय के सभी सदस्य मंच पर आए। और अब हमारे ये सभी सदस्य जो हैं बहुत अच्छा हमारे ये सभी मेंबर बड़े जुलूस के साथ प्यार के साथ
श्री भूपेंद्र कुमार जी, डॉक्टर मुत्तू प्रोजेक्ट डायरेक्टर, प्रोफेसर मीनू महाजन प्रिंसिपल GMC. Today we are here to celebrate the World AIDS Day. It is a day on which we reiterate our commitment to fight this disease. We have seen over the years that from when it was discovered, we have come a long way, and today we are in a position to ensure that a person who is infected with this disease can still live a meaningful, healthy and progressive life with hope and confidence. At the outset, I would like to congratulate the project director and the JKH Society, and also the support that is provided by the health services and medical education institutions and also Ayush. I would also like to appreciate the work of NGOs which is being done in this sector, which is really praiseworthy. I would also like to especially commend persons like Radhika ma'am, who was being mentioned by some of the patients who have come here. It is indeed people like her who are able to generate the hope and the confidence and the trust that is required to deal with the kind of stigma that this disease once used to have in society. As has been pointed out by Shri Bhupendra ji, unfortunately, we treat a sick person as, like he had mentioned leprosy, he has mentioned COVID, he has mentioned a few other diseases. We consider a diseased person as to be a sort of an untouchable, as to somehow we make it feel that the fact that he has got this disease is his own fault. We have to come out of this way of thinking. We have to understand that a patient who is infected with any disease, especially AIDS, is a person who requires our care, attention, love, and also support, so that he is able to, like any other citizen, he also has a right to live a meaningful and healthy life and contribute to his family, his society, and to his country.
We have all gathered here to observe 35th World AIDS Day, and the theme of this particular day for this year is equalize, that achieving equality to end HIV. So, what is basically equality and why do we aspire to achieve that? As we would know, and my previous speakers have also mentioned, that access to healthcare remains a challenge, especially when it comes to AIDS and people who are affected by AIDS. It's a global commitment to have access to healthcare which is affordable, which is equitable, which is non-discriminatory, and this access is uniformly available at every level, not only for the patients who are admitted but also patients who seek counseling, patients who come to our facilities for other OPD needs, and also for mental health. So there's a global commitment that every country is striving to achieve, which is called universal health coverage, but we are also on the track. And under the same umbrella, we have been striving to provide AIDS-related healthcare in a more universal and equitable manner. Talking of India, we have nearly 25 lakh people who are battling this disease at one or the other level, and even last year, we had globally 15 lakh new infections. So you would understand that the disease was discovered roughly with the virus around 40 years ago. Still, the impact and the spread of disease is quite a large, and especially in African countries, especially in developing countries, the disease still takes a heavy toll on the economy, on the lives.